Hi, my name is Brandon Riddle. I'm a graduate student at Arkansas State University pursuing a master's degree in strategic communication. It's great to speak with you today. My literature research project focuses on telehealth and its role in improving access to care, particularly in underserved and rural communities. The central question at hand is how effective is telehealth in reducing barriers to care, improving patient outcomes, and leveling the playing field when comparing traditional in person visits? In recent years, telehealth has revolutionized healthcare and made it easier for those constantly facing immense barriers that prevent them from receiving the potentially life saving care they need. Recent increases in telehealth services such as patient visits, urgent care consultations, virtual rounding on patients, and remote check ins around the clock are nothing short of remarkable. As technology continues to advance, we see these telehealth practices become more commonplace in every aspect of healthcare. In my day to day operations at work, I witness this technological innovation enter the conversation now on an almost daily basis. I have the ability to help shape the narrative that patients, caregivers, family members, and others see when they encounter new technologies such as telehealth. The COVID 19 pandemic spurred significant growth in this area as patients looked for ways to still receive necessary care, but in ways that required less risk of exposure to the virus. As a result, providers and healthcare organizations began realizing the potential of telehealth even more so. Millions of people continue to face barriers when it comes to receiving care for existing and emerging conditions, including cultural priorities, socioeconomic status, and geographic location. Scholars are examining cases in which patients can benefit from remote or virtual care, solutions to bridge these divides, and ensure that healthcare is equitable for all. Telehealth has emerged as a potential important solution, but there are still critical questions that must be addressed about its effectiveness and sustainability. Culturally, language differences, nuances among certain ethnicities, and overall health literacy can pose challenges for effective provider patient communication. Socioeconomic disparities, such as income and education, can make it harder for certain patients to access transportation for appointments, technology to keep up with medical records, or care and awareness of conditions they might need to look into further. Geographic location additionally plays a pivotal role in healthcare access for patients. Patients in certain rural areas may face a healthcare desert where certain medical specialties are unavailable. That's where telehealth could play a role in making healthcare more within reach. By addressing barriers, telehealth has the potential to help patients live happier, healthier lives. Through research, we can learn more about how telehealth improves quality of care for chronic conditions such as diabetes, heart disease, and high blood pressure. Remote monitoring has become an important tool to track patient progress and make timely interventions. Through telehealth, patients with mobility issues can face easier tasks to receiving the care they need without the stress of travel and related costs. Also of importance to healthcare organizations is the potential cost savings that results from telehealth, and maybe most importantly, patient outcomes overall could have been shown to improve in scholarly literature, resulting in higher levels of satisfaction, better adherence to treatment, and overall well-being. This research aims to add a new perspective to ongoing conversations about telehealth and its adoption across certain demographics. Scholars and providers alike are considering whether telehealth is a supplement to existing care or whether it takes the place of traditional care at in person clinics or treatment centers. My research explores more than just whether telehealth works, it examines who is currently benefiting from telehealth, who is continuing to face barriers, how the technology is adapting and changing, and what the future holds overall for telehealth. Examining existing scholarly literature enables us to learn more about how to best implement and alter telehealth over time so that it reaches its full potential. From this project, my goal is to share studies and formulate findings that tell the story of how telehealth is transforming healthcare as we know it, hopefully for the betterment of patients who lack the means to receive critical services. The insights will analyze how telehealth is fostering a more accessible, equitable, and resilient healthcare system that benefits more patients.